Johnny Del Rosario, and you're watching Medical Dilemma. Medical science now allows the culturing and control of human stem cells to produce the different tissues in the human body. Moreover, stem cells lend itself to other promising applications that include regaining one's youth. However, controversy envelops this capability, as one source of stem cells is human embryos. In this episode, we look at this advanced technology that is beyond skin deep and allegedly holds great promise in curing many diseases. Our guest for the first segment is Dr. Francisco S. Chung Jr., a specialist in cancer biology and PhD in pathology and molecular medicine. He's also co-director of the Cellular Therapeutics Center of the Makati Medical Center. Welcome to the show, Dr. Chung.
Hi. Thank you for having me on this show.
Okay, now let's start with the basics, Dr. Chung. Okay, first of all, what is your background really all about? You know, what do you do in your everyday practice?
Well, in our facility, we culture cells, stem cells, we grow them, and then we monitor, we check for their purity, viability, as far as to their functional ability.
Okay, and what are the applications of this practice?
Now, since the administrative order of Department of Health was released, so the use of cell-based therapy or stem cell therapy is very limited to 3 indications.
3 indications.
And
okay, which
primarily, it's being used for hematopoietic stem cell recovery, and this is pertaining to leukemic patients.
Okay.
So a very excellent example would be bone marrow transplantation.
All right.
And as we all know, bone marrow transplantation is a form of stem cell therapy. It's been around since the 1970s. And there are other 2 indications wherein stem cells can be used.
Okay.
Now, aside from the other 3 approved indications, the Department of Health administrative order is very clear that it can be used for compassionate use on compassionate grounds.
All right.
And the other route is through clinical trials.
I see. Now, let's go over to the concept of molecular medicine. Okay. What is molecular medicine really about?
Okay.
Kindly explain in simpler terms.
So molecular medicine is an emerging technology. So as we all know, medicine, there's a continuous progress.
Yes.
A good example would be how to benefit for this technology, molecular medicine. Breast cancer patients in particular can avail of drugs that is meant to target molecular signatures or unique property of breast cancer cells. So this technology came about by targeting only specific targets or proteins present in breast cancer cells.
So these practices are different, I suppose, from chemotherapy and radiation. Am I correct?
Yes, that's a correct statement. The advantage of having a directed therapy, number 1, you eliminate significant risks of having adverse event or side effects. Unlike conventional, we call it traditional or conventional therapy, wherein a particular drug may end up hitting or getting the normal or healthy cells. So we have reached the age wherein drugs can be customized. Drugs that are, we call it smart drugs, that can, determine which particular target or cancer cells are gonna be hit by this technology.
And so the effect of such drugs is more surgical, okay, rather than like a blanket bombardment of the disease.
That's correct. That's
I
correct.
see.
So less side effects.
Yes.
Good for the patient.
Okay, that's good news for our viewers. Now, let's go over to stem cells. Okay, first of all, what are stem cells and why are they named so?
Okay, stem cells is the origin of all cells that we have. So part of the reason why we have eyes, because of our stem cells, our body, our liver, different organs develop because of stem cells. So as we develop, as we matured, and there would come in our life that we will have injury, we will have accidents, we will have disease or organ damage, tissue damage. So these stem cells are sort of a repair or a spare cells, wherein they are heavily involved in repairing or replacing worn out or damaged cells.
And this replacing characteristic of stem cells, it works until until today.
Yes, yes, that's correct. For example, liver, you have alcohol in your system, your liver will get damaged, and then because we have liver stem cells, our liver can regenerate.
So it's actually a natural reaction of the human body.
Yes, and it's what we call a healing within our body.
I see, I see. When did stem cell research, in fact, the whole field, start to develop? And where did it originate from?
It started in the U.S. by the time of 1980s, but the downside, since they were pioneering this technology, the downside of that discovery during the time of President George Bush, George Bush, totally banned the use of embryonic stem cell.
Embryonic stem cells, so meaning stem cells
derived from
taken from
embryos,
human embryos. Okay, so that's why it was banned, because George Bush, I suppose, was a very conservative president. Okay, so after it was banned in the U.S., okay, how did it advance?
Now, decades later, scientists have discovered that stem cells can be sourced from adults, meaning grown-up adults can be a good source of stem cells. So this is now the time wherein embryos are not being used as a source of stem cells.
I see. And so does it mean that the use of human embryos can already be discarded?
Yes, so there are very few centers in the world that is still making use of embryonic derived stem cells. But if you look at all the ongoing studies, most of the stem cells being used now are derived from adults.
And the efficacy of such stem cells, is it just the same as those taken from embryos?
Okay, good question. Now, the efficacy, when you talk about efficacy, you would need several years in order to determine whether a particular cellular product is efficacious or not. Now, comparing embryonic stem cell versus adult-derived stem cells, I would say the outcome is equally good.
Equally good.
And you also prevent potential problems if you're going to make use of embryonic-derived stem cells. From embryonic-derived stem cells, if there are certain challenges because there are still some unknown potential adverse events or effects.
I see. Now, there are certain applications, I suppose, of stem cells that are already quite popular, or maybe we should say mainstream. Okay, and I guess there are still other areas that are, still being researched on. Okay, could you name a few of these applications?
Okay, so one that is very matured in terms of technology is bone marrow transplantation.
Bone marrow.
So BMT, or bone marrow transplantation, is a form of stem cell therapy. And this therapy is being used as a standard of care in hematological malignancy, meaning some patients suffering from leukemia.
Yes.
So adult stem cells can be derived from a donor, and leukemic patients can undergo chemotherapy after ablating or removing these cancer cells. It can be replenished or it can be recovered from the donor of a stem cell via transplantation.
I see. And what about those areas that are less mature, as you put it?
So it is not a magic potion. So that's number one.
So it's still not a panacea for everything.
Yes, and one thing that I would like to be very clear on, if you have stem cells, you will not look 16 years old again. So there's no way that, your age will be reversed. So that's one information that we would like to...
So it's a myth that it's a fountain of youth.
Fountain of youth is still up in the air when you talk about stem cell.
Okay.
Now, in terms of other clinical applications, I would say in the field of cardiac or heart disease.
Yes.
So I'm looking at within our lifetime,
Mhm.
it will be included as part of the standards of care.
Okay.
So for cardiac, some neurological disorders.
Mhm.
So they are now, I would say, leading the race in terms of studies.
Mhm.
So for any drug or therapy, before it can be approved, it has to undergo different phases of studies or clinical trials.
So this therapy you mentioned can actually regenerate nerve cells.
Yes, that's correct. And we have preliminary studies in our center wherein a cardiac patient
Mhm.
demonstrated improvement in terms of their pumping efficiency. So one very simplistic analogy that we could compare our heart is through a mechanical device that is constantly pumping blood.
Yes, yes.
So as we age, pumping efficiency of our heart diminishes. And as we have disease, it will become compromised. So pumping efficiency significantly would reduce over time. So there's
Okay.
no available drugs wherein we could reverse or improve pumping efficiency. Even the scar or ischemic scar from the heart because of the insults or the damage, in our study, we managed to demonstrate that even the scar significantly reduced.
Reduced. So in other words, the therapy sort of redevelops the heart muscle, makes it
And-
stronger.
And this is consistent with the initial findings from another laboratory in the US, wherein they have shown that the scar from the heart started disappearing over
Disappearing.
time. So this is a news that is so hard to ignore,
Mhm.
wherein scars can be removed, especially, scars in the heart.
And despite these developments, you still think that we're still far from a scenario where stem cell therapy will be the cure for practically all kinds of diseases?
Yes, I think it's very premature for us to consider that stem cell is a cure for all the maladies of the diseases that we are facing.
I see. Okay, thank you so much, Dr. Chung, for that basic information. We'll take a commercial break, and we'll be right back after a few words from our sponsors.